Hi, my name is Mohammed Arsalan. I'm one of the Anaesthetic registrar at University Hospital Limerick. Today I have the opportunity to present an interesting audit on anesthetic practices in hip fracture surgeries. Our theme was spinal recovery. Why we did this audit? Because hip fracture patients, they are very frail, they're elderly, and they're high risk for general anesthesia. And spinal anesthesia is usually the preferred technique among these. And dose of spinal and hemodynamic support varies from patient to patient. Post-operative analgesic strategies, they also vary, and they are not standardized regarding the peripheral nerve block, dexamethasone. So we collected the data from 66 patients, and we found that 66% of the patients were more than 80-year-old, and among them, 66% of patients were females, and half of the patients were ASA3. Our questionnaire included dose of bupivacaine, adequately documentation, adjunct used, sedation used, either the procedure were converted to GA, hypertension recorded, bradycardia, vasopressor use, peripheral nerve block given, and dexamethasone given or not. Data we collected shows that 33% of the patients were not clearly documented the dose of bupivacaine, and 84% of the patients developed the hypotension, and definitely 84% of the patients received the vasopressor, and only 33% of the patients received a peripheral nerve block for analgesia. Sedation used along with spinal anesthesia were midazolam in 18% of the patient, and there was no sedation in 24% of the patient, and 46% of the patient received the propofol TCI sedation. Dose given, bupivacaine dose given was 10 to 15 milligram, and 12% of the patient were converted to general anesthesia, and dexamethasone was used only in 21% of the patient. So there are gaps that we can improve. Key findings are 1 in 3 spinal doses not clearly documented that needs improvement. Hypertension as well vasopressor was used in 85% of the patient that we can improve. Either we should reduce the dose of bupivacaine or we should avoid the sedation. And 1 in 3% of patients receive peripheral nerve block. That also shows that we should improve the frequency of giving the peripheral nerve block because it will help in the post-operative analgesia. Thank you.